I think we'll start the program for the day. Good morning, everybody. I'm Dr. Kiran Kumar K, Professor of Psychiatry at Vaidehi Institute of Medical Sciences, Bangalore. I'm also the coordinator for the Sunday Special 60 Minutes program on behalf of the Minds United team. It's my proud privilege that we have finished almost 1+ years in this program and we are continuing. Today, I welcome you all for the special Sunday Special 60 Minutes with Psychiatry teachers. This is a combined effort of IPS Faculty Training Task Force, IPS UG and PG Education Sub-Committee, along with support from the IToP team and the Minds United team. We have been reiterating this fact that it is a self-sufficient program without any pharma involvement. And all the program details are available on our YouTube channel, which is free to access at any point of time. Today, we have been having a special theme on UG-CBME. We know that the first batch of CBME batch students will be coming to their psychiatry postings, particularly the electives from this year. So it's right time that we discussed on this new concept of UG-CBME, which is bothering us. There is not much of uniformity across India, though MCI and NMC has given specific indicators. So to know more about it, we have very good speakers today. First is my good friend, Dr. Anil Kumar MN, Associate Professor of Psychiatry from KMC Manipal, who will be talking about self-directed learning in psychiatry. Followed by Dr. Dheerendra Kumar Mishra, will be talking on electives in psychiatry. He is Assistant Professor of Psychiatry at Shah Medical College, Rewa, Madhya Pradesh. He was also our IToP Steps scholar of the past year 21-22. We have our young colleague, Dr. Pranav Kashyap from JSS Mysore, who will be talking about what students should, which books should they refer, particularly the CBME curriculum in background kind of thing. So it's going to be a quite enriching session for all of us. Without much of a delay, I would like to hand over the session to Dr. Anil. Welcome, Dr. Anil, and over to you, Dr. Anil.
Thank you, Dr. Kiran, for your kind introduction. And I also thank IPS Minds United and IToP's team for providing this opportunity to me today to speak on self-directed learning in psychiatry. I had to also make some self-directed learning on self-directed learning, which has been a new concept introduced for UGs by the Medical Council. So for the next 15 to 20 minutes, I'll be covering these areas in my topic: the types of learning, then self-directed learning, advantages of self-directed learning, role of teachers, and obviously nothing is absolute. Every kind of learning or anything comes with some critics as well. So I'll be discussing these areas today. So to start with, there are two fundamentally different types of learning. One is pedagogy and the other is andragogy. Pedagogy is the teacher-directed learning, which is just a transfer of information, which is a conventional type of learning that happens especially in schools. So the outer influence actually determines the influence of learning in pedagogy. As opposed to that, andragogy is self-directed learning. Here the learner is independent to choose his methods of learning and to know what to learn and how to learn. And here teacher facilitates this learning, and this is suitable for adult education or higher education. So one is more ideal and the other is more practical. So we'll talk about what is SDL or self-directed learning. It is a multifaceted concept. There are several student factors and teacher factors. Student factors include the motivation, the enthusiasm, and also the ability to learn and ability to understand and perform in the outcome measures. And teacher factors includes the teacher's ability to understand each individual student and tailor his education methods based on the student's abilities. So it's difficult to easily define self-directed learning. It has different synonyms: individualized instruction, student-centered learning, prescriptive learning, self-regulated learning, self-teaching. Okay, and this concept of SDL, it's not very new. Historically, in the year 1913, it was first introduced or spoken by one John Dewey, who was a American philosopher and educational reformer. Though this was introduced strictly into the educational, the teaching patterns much later in 1970s, and the pioneering work was done by Malcolm Knowles. So this was driven by the advancement in the technological area as well as in the societal changes. So in the present day, we need not have to solely depend on teachers. There are different sources of information to learn and access to those sources. So under guidance, this new method of learning has been possible. Basically, it is the transformation that should happen in the educator from authoritative role to the facilitator role. With this transformation, the outcome that comes is self-directed learning. So this is the most accepted definition, though it includes several areas of self-directed learning. It says a process by which individuals take the initiative with or without the assistance of others in diagnosing their learning needs, formulating learning goals, identifying human and material resources for learning, choosing and implementing appropriate learning strategies, and evaluating learning outcomes. So the entire responsibility falls on the shoulders of the learner here. We might have seen the schools where teachers are worried and the management will be kind of taking teachers to task to increase the pass percentage or increase good results, because that's affecting the school performance and school grading, because there the entire teaching is teacher oriented, teacher directed, whereas here the responsibility lies maximum on the student. Is there any theoretical framework for this? Yes, the humanistic theory is a broader theoretical framework under which these concepts of learning can also be a part of it, wherein the theory says that human beings are unique, and this uniqueness calls for an individualized approach to learning. So basically, humanistic theory says we are all equal. Okay? There's nobody superior or inferior, but we are special in our own ways. We have our own talents. So it considers self-direction not only as the end product of learning, it's a process. We all know this, popular story of different animals being asked to climb the tree because that's a fair examination. Obviously, that's a fair test, but that is more ideal rather than practical. So we all have talents and we all have different ways to learn, different methods to learn, and that is the theoretical background of how SDL works. Advantages. So these are all evidence-based. There are studies that have inferred that people who take the initiative in learning learn more and learn better than people who are passively being taught. And self-directed learners are being motivated better, and they tend to apply knowledge in their practical life. So this applicability of the knowledge comes more with SDL rather than with the passive learning. And SDL also promotes lifelong learning. This is even more important, okay, because especially for doctors, we are lifelong learners. And greater the capacity for becoming a self-directed person is, the more tendency there is to be a mature person. Maturity in this context means the conceptual understanding of different knowledge areas. There are different stages of students for which the teacher has to adjust himself to. If the student is dependent, which usually happens in the very first few weeks to months of the MBBS course, where the teacher should be more authoritative or should be coach. And then for an interested student, the teacher will be a motivator or a guide. For an involved student, teacher will become a facilitator, and for a self-directed student, he will just be a consultant or a delegator, just saying things, do this, do that. Okay, no more advice is required. So obviously the first two are not the stages of self-directed learning. It is the last two, that is the involved student and self-directed student, are different stages of self-directed learning. Okay. So the next question arises, is it an innate quality? The answer is no, but the important aspect of self-directed learning is the ability of the student to know whether he can learn to learn. Okay. There are a lot of learning how to learn courses. In fact, we doctors are trained by MET workshops. There are also a lot of learn to learn courses in Coursera if you enroll into it. So this is an important aspect that facilitates self-directed learning, because there are certain aspects which can be learned only by books, and certain aspects that can be learned by videos or audio tapes or the role play. So what kind of material can be learned best by what method is what the student needs to know, and this is where the teacher should facilitate. And the other evidence-based finding is level of education is an important factor for SDL. Those who are educated up to graduation and above, they feel this SDL is easier to adapt compared to those who are having lower level of education. And the studies have also found that there is no role of age. So at any age, provided you have a higher level of education, you can adapt to SDL. Say you do your PhD 10 years after your MD, it is still possible because your level of education is high and you can adapt to it. So SDL is essentially mastered by knowing and learning how to learn, which is individualistic, and teacher facilitates the learner in mastering this. However, another important fact is each individual's ability for SDL differs. Okay? Not all are in the same level, and that is what the teacher needs to know and facilitate him to progress to higher levels of being capable of learning through self-directed learning. So the teacher's role in SDL. These are the 7 important roles that a teacher can play in promoting SDL: being competent, concerned, creative, facilitator, motivator, and being a partner. And finally, by accomplishing all these roles, by being a role model. Let us study these one by one. Being competent means it relates to the teacher's qualification, teacher's expertise, and experience. Okay? So the qualification is our teaching qualification, experience is the number of years of experience that we have, and expertise is obviously whether we know we are trained in SDL, which obviously happens through our MET workshops and other sources of learning where we can become masters of how to teach SDL, to become SDL. Then concern, obviously teacher should be not just a teacher, but he should be a guide, and he should care for the student and be an educator rather than just a teacher, which involves, which is a more broader concept of teaching. And creativity. There are a lot of ways for creativity. Say, for example, if a student needs to learn about management of alcohol dependence, that can be taught in the classroom setting, or it can be taught in the setting of a inpatient ward. But what can be unique is allowing patients to do a home visit. So priorly, if everything is arranged and the patient is willing and the student, a group of students go there, small group of students, and actually understand what is the scenario of the patient's home and what are his psychosocial circumstances and whether he is able to quit, and what best ways can be adopted to facilitate him to quit. So this won't come by a doctor just judging a patient in the hospital setup and asking him, these are all the complications of alcohol, so quit alcohol. So we have more crucial information by this home visit, and you can come back and you can discuss within your team as to what individually tailored measures can be done for this patient. And if there are more students, split into different home visits. So each student from their own group and visit respective homes and formulate an individually, applicable treatment guideline, and then all groups discuss among themselves and in the larger group and with the consultant. So that's how this creativity can actually bring in new ways of treating, which is tailor-made. Facilitator, ability of the teacher to teach how one can learn to learn. So as we discussed, he should facilitate in students to learn and encourage students to find the best method of learning. Not all can read books and masters. Some are good in grasping through audios, and some are good in videotapes, and some are good in playing role play. So, and also there are different, as I mentioned earlier, different things can be understood by different methods. So teachers should facilitate in choosing these methods by students. And motivator, it's the ability to give a constructive feedback. Okay, that is very important. So negative feedback doesn't always help. Being giving a constructive feedback involves first starting with the positive aspects and then the negative, and then again ending with the negative aspects of how the student performed on some outcome measures based on SDL. Finally, the partner, an approachable and friendly in professional matters is being always better than being strict and authoritative. So being friendly and professional, approachable opens up the student and teacher relationship, and they can master their skills by teacher being open to them always. And being all these, having attained a competence in all these 6 areas, one can actually become a role model, and which can actually go on to generations, because we all have our role models. As students, we try to imitate our teachers, whatever we have learned good from them, and that will pass on to our next generation, and again it goes on from generation to generation. So whatever is good will be passed on easily. So these are all the roles of a teacher as far as the self-directed learning is concerned. So how can this maximize the learning outcomes of students? There are these 3 aspects that we should know. One is the ability of the teacher to identify learners' skill levels and set the level of change appropriately. Say, for example, a Kirby's method may be read by some students, and another set of students may actually read it and apply it, and the third set of students may also interpret it, but all are not in the same level. So it's the it's the ability of teacher to know what each student can perform and challenge him appropriately so that he is not demotivated. And then the ability of the teacher to challenge the learner in ways he would not challenge himself, to ensure that he does not fall prey to illusions of competence. Okay, so a lot of times overconfidence can make us disillusioned, and actually we think we are competent, of which we are not. And this is another area where the teacher should identify and make the student realize his actual abilities, and then support them further in building up their abilities. So then finally, assessing SDL. There are different rating scales to assess the self-directed learning. Okay, so one of the important rating scales is Autonomous Learner Index. It's a Likert scale, and it is administered to students before and after a learning experience through SDL. So there are 6 areas in which the student rates how much he felt better. Based on this, we can also try to group students as the average, above average, and below average in terms of SDL, and then accordingly we can train them to reach the higher levels of ability to understand techniques of SDL. Finally, criticism. So in today's extensive access to information is overwhelming. So asking a student to talk on, giving a topic to talk on, say, supportive psychotherapy, today and 30 years ago, there's a lot of difference. So now there's a dearth of information, and student will actually learn a lot of things, and finally he'll end up in confusion as to how much to cover, what not to cover. So this is one of the criticisms, that there still needs to be some supervision. You can't just let them do whatever they want to read. And the second one is STL is only complementary to pedagogy, but not absolute. So at the undergraduate level, it is not a supplement to pedagogy. You cannot just implement that as a whole and soul method of teaching. It cannot be the only way of teaching. Without supervision, the learning can be erroneous. So these are two common criticisms. So at KMC here, in the UG level, what we do is, say, for example, if a teacher is given a topic of SDL on cognitive behavior therapy in depression, so there is a specified stipulated time of 1 hour in which we meet the students and we give them the link or the PDF of what is to be read then and there, and they are given about 1 hour's time to complete their reading, and then we come back and we assess them by giving certain questions. Depending on, again, the topic, we can give 4 or 5 MCQs, or we can give one short note question. So this is again not specified by NMC. And then once they answer those questions, we can give the feedback either then and there or later as to what went wrong. The group feedback is usually better. And we can specifically address both the positives and negatives and motivate them. So this is what we are doing in terms of SDL for UGs in KMC, and I think that's it from my side today. To summarize, we discussed about different types of learning, and then I told about SDL, advantages of SDL, and role of teachers in SDL, and finally some criticisms. And these are my main references for today. And that's it. I think there is a separate slot given for discussion, so we can take up questions at that time. Over to my next speaker. Thank you.
Thank you, Dr. Anil. Definitely, we'll take few questions at the end of the session. Following self-directed learning, which is very important concept in CBME, we go on to the next important topic, that is electives in psychiatry. As I told, our UG colleagues are coming to psychiatry this year. So let us see what we have in store. Dr. Dheerendra Kumar Mishra, over to you, sir.
Thank you, Kiran sir. Thank you.
Yeah, Dr. Anil, if you don't mind, you can close your presentation.
Yeah, sure.
Yeah, thank you. Yes, sir, Dr. Dheerendra.
Yes. Sir, my screen is visible.
It's visible, sir. You need to put it in full screen mode.
Yes. Slide is also moving, sir?
No, sir, I'm not able to see.
Okay.
Yes, sir.
Yes, just 2 minutes.
Yeah.
Slide is moving, sir?
Slide is moving, but not in full screen, sir. You can maximize it, sir.
Yes, sir.
Yes, sir. I think you can go ahead. It is visible,
Okay,
but
okay,
not,
okay.
yeah.
Thank you. Good afternoon to respected teachers. Today we will discuss elective in psychiatry. As Dr. Kiran sir says that this year the pre-final exam is I think going on, or it will be over in next 1 and 2 months, and the time is come to choose your electives. The main objective for this presentation is to discuss the enumerate the various components of CBME, need of elective and allocation of how we allocate the elective to between the students, what is the elective blocks 1 and blocks 2, what is the elective modules and topic for elective module in psychiatry, and what are the challenges faced to effective implementation of electives. Now we can say we are know that the CBME curriculum based medical education launched in 2018 and effective in 2019-20 batches for MBBS, and basically 6 component is brought are new in CBME. First is a foundation course. As we all know, the in first year students before first 1 month is taken as a foundation course, then early clinical exposure. Third one was the elective. Fourth one was ATCOM module, and fifth one is a learner doctor method or clinical clerkship. And among these 5 newer components, we will today discuss the electives. What is the electives? Electives is a learning experiences created in the curriculum to provide an opportunity for the learner to explore, discover, experience area or stream of the interest. This definition was provided by the NMC. And basically the purpose of this module elective is to stimulate the inquiry among the students, self-directed learning as discussed Dr. Ajay sir, and experimental learning and lateral thinking. These are the main objective to inculcate in our UG students. And although this is elective, students can choose, but this is a mandatory to do elective, and do not use this time. It's a 2-month time of elective postings, and do not and should not used for the other activities like you are try to these you thought that this is a free month and we can take advantage to cover the courses of other subjects, or you have tried to complete your missed postings. So although this is elective, but this is mandatory and compulsory. And elective is it's divided in 2 blocks. First is block 1 and second was the block 2. And first block is means end of the 3rd year MBBS part 1, means after the 3rd year exams students goes on before going on the final exams, the 1 month period is in a block 1, and block 2 is just before commencement of 3rd MBBS part 2. It means between 3rd year and 4th year, between 3rd year or final year, you have 2 months. Initial month is labeled as block 1, and later one month was labeled as block 2, and the duration of each block is 4 weeks. And in block 1 basically focused on focus areas of para and preclinical disciplines are in other basic sciences. Laboratory are joining ongoing research programs, and in block 2 the basically clinical specialty and community clinics. So in elective we have basically 3 areas of interest: research area, clinical or community areas. In block 1 you should be preferred for the basic sciences or research areas. Many institutes having various ICMR projects, various virology labs, these kind of activities was going on in preclinical and paraclinical departments. So the initial in block 1 the students can choose an elective from these areas, and in block 2 the students choose from the various clinical super specialty departments or the various sub-specialty sections in department under the departments, are in a few community programs is running few institutes like in under department of PSM, under department of community psychiatry. So in the block 2 the students prefer to choose a clinical and community clinics. And the nature of learning is basically supervised, experiential and immersive and self-directed, and it's both in both blocks the nature of learning is same as we already discussed about the SDL self-directed learning. It's on a supervised self-directed learning, and students experience what is going on, how they feel, and in block 1 the important thing, it will continue with your regular postings. You have also regular posting schedules like 9 to 12 you are go on the wards, and after remaining time you go for the block 1 elective postings. And in block 2 the elective your routine ward postings and other classes was suspended, and you are exclusively devote your time in elective postings. In both blocks the 75% attendance is mandatory, And assessment formative record activity like logbook and portfolio maintenance is also compulsory, and these both assessment and attendance are submitted 75% attendance, and your proper record keeping and whatever the objectives to achieve in your elective posting is mandatory to appear in a final year exams. If you students thinking about, or if you are thinking about that ki elective posting just easy and you are not taking seriously and miss the posting, and you have not able to score your 75% attendance, then it will be difficult to participate in final year exams. So take it seriously. And out of institution is not allowed in block 1 because of we already knows that in block 1 elective postings our routine clinical it's continue with routine clinical posting, so it will be difficult to out of institute participate choose out of institute choose for elective posting. And in block 2 it is allowed out of institute you can choose elective postings, but within a state. If you want to move on out of state for elective, you need to take permission from NMC through the proper channels. Out of the city or state has been allowed, but difficult. It's same thing, allowed with approvals. So the elective between third year and final year, between third and final year, block 1, block 2, we already have understand what is block 1 for pre and paraclinical, block 2 for the clinical subjects. Now, what will be the mechanism for allocation of electives? Because of most of the medical colleges have 150 to 250 capacity, and 250 capacity students to allocate in a small groups for the elective posting, it's a really challenging and difficult task. So NMC documents clearly stated that institute can choose your own method to allocate the elective postings. In my institute, we are was going to practice these mechanisms, so I would like to discuss here. The things are connected by the medical education unit. Medical education unit call all the preclinical, paraclinical and clinical department to submit their elective modules. Each department can plan their elective modules, and when MEU call, all the departments submit their elective modules. In next slide we will discuss what is the standard module pro forma, what is the information is needed to be filled in pro forma and submit to MEU, and department submit the elective module to MEU. Now MEU display the list of elective postings and invite the student to interest to choose. So suppose that we have a MEU receive a call from MEU, and the department of secretary made a 3 or 4 elective posting depending upon the available resource faculty and infrastructure, and we have submitted the our module for elective, and similarly the other departments also submitted their module. Now MEU display all the modules in their notice board at least 3 months prior to start of the elective postings, and they also mentioned the not only they mentioned the name of elective posting, but also mentioned all the things like what is the prerequisite needed to participate in this module, what will be the assessment, and how the formative assessment logbook and all the things are prepared. Everything disclosed at least 3 months before the electives, so the students are well informed and can choose those electives. Now students choose electives, and we given basically 3 or 4 options. You given your priority number 1, I will choose ABC. Priority number 2, use C, D, E in medicine department. Priority number 3 will choose in a surgery. These kind of, as like in counseling, some institute also follow the counseling, proper counseling, as like we are seen in UG and PG admission counseling. The students come and choose according to their rank, their colleges. So here we can call for counseling, or we just fill the form to choose your 1, 2, 3 choices of electives, and MEU scrutinize the interest and allot the electives and inform to concerned department, and after the whole responsibility shifted on the department where the students are allocated. Head of departments are basically monitor and either own or can designate any one faculty to coordinate these elective postings. Now next is a template for planning learning experiences in elective. What is the, as I told that every department submit their module for elective. This is the standard pro forma provided by NMC documents. What will be the structure of module? The first thing is the name of the block. You must choose whether you are submitted your module for block 1 or block 2. As we all know, the block 1 for pre and paraclinicals, and block 2 for the clinical and community postings. And the name of the elective, as like here in the psychiatry I have written here neurocognitive assessments. Location of the hospitals or research facilities, our hospitals. Name of the internal preceptors department psychiatry, or you can also mention here the name of any dedicated any faculty in your departments. Name of the external preceptor if applicable. Now you should also mention what is the learning objective, what is the SLO of this elective postings. Here I have tried to design some SLOs like enumerate the neuropsychological assessment tools for IQ assessment, enumerate the tests used for cognitive assessment, interpret and communicate the results of neurocognitive tests, and formulate the plan for rehabilitative interventions for ID patients, ID children. Next was for this module, the number of students can be accommodated. It will be depending upon your available resources. Here we have as like one clinical psychologist and 3 faculty in department. So here here labeled as 4. We can take only 4 students at a time. And what is the prerequisite for what is the needed prerequisite? The interested and motivated to the work for rehabilitation services for mentally ill people. This is a prerequisite for students. And what is the learning resources for students? The NIMANS, PGI, neurocognitive assessment battery, and list of active what the student will do in the during the elective postings. The list of activity of student participations. The assess the need and determine the type of neurocognitive test in patients. Which supervisor help them to apply the neurocognitive test. Observation and recording of the test data, interpretation of the data with test manuals, participate in the preparation of final results and communication of results with the caregiver, and in a supervised manner design a rehabilitative plan for the given patients. This will be the list of activity the students participate during the elective postings. Next was the portfolio entry. As we discussed the elective postings, no summative assessment was conducted. The formative assessment was done in the form of portfolio entry and logbook entries. The portfolio entries are the indication in portfolio entry, the students must maintain indication of the neurocognitive assessment, how to determine the neurocognitive test required for the given patient, worksheet for the applied neurocognitive assessment test during the 1 month of posting. The suppose a student applied 3 or 4 neurocognitive assessment test over the patient, so the worksheet should be incorporated attached in portfolio, and submit the final results and written plan of the attended cases. So as we have discussed the SLOs 4, the students make a plan for a rehabilitation plan for the patients. So the students also attach these plans in their portfolio also. And next one was the logbook entry required. It is satisfactory completion of the posting certified by the preceptors, and assessment, the submission of complete worksheet results and rehabilitation plan and 2 IQ tests and 2 neurocognitive tests. If the students are able to do these 3 things, 2 IQ tests, 2 neurocognitive tests, and submission of all the worksheets, the assessment will be complete, and the department certify the students have successfully completed and achieved the required skill for during this elective. And if any other comments is needed, so we submitted our module for elective postings in these 14 headings. Some other topics can be chosen for the elective posting in psychiatry, like neurocognitive assessment test, brain stimulation technique, whether we can choose or not. There 2 things is there stated in NMC document, that the chapters which are your main curriculum are part of the main competencies. It's better to be avoided in elective, because of elective is the concept, the main motto of elective to give an extracurricular interesting topic. So the brain stimulation technique, usually we learn these techniques in our competencies. We have one of important competency in psychiatry, but still the practical aspect or hands-on practices are not is not in the curriculum of UG psychiatry courses. So this can be taken. Predictive test, personality test, and these are the few skills and these are few setups, like child and adolescent clinic, few department of psychiatry running routinely, and excellent number of OPD patients in child and adolescent clinics, de-addiction clinic, geriatric clinics, and community psychiatry services. These are the few suggested topics from my side for the elective in psychiatry. And what are the challenges to effective implementation of the electives? We face at least all the dimensions at all level of the challenge, in institute level, in course coordinator level, and at student level both. In institute level, we have limited number of faculty, like most of the psychiatry departments have only 1 or 2 faculties. Infrastructure and trained faculties. These are the basically limitations or challenges from the institute side. And the challenges as course coordinator side is the elective module where most of the department, they are not timely submitted their elective modules. Allocation of electives, many times the same many lot of students choose a single elective chosen only one elective post, so it will be difficult to accommodate all the students in one elective posting. So this is another challenges. And one important thing is a program evaluation. Program evaluation is the important steps to improve or evaluate the program, because of we are running elective in first time in our colleges, and after the first time implementation of the elective postings, what was the outcome, whether we have achieved our expected results or not. So all these things should be evaluated, and this all things done by the all stakeholders, the inputs from the all stake like students, peer faculties, departments, course coordinator, MEU members, every stakeholders given their inputs, and they sit together and evaluate their electives, whether they are useful, where they are effectively implemented or not implemented, and if implemented, the desired outcome achieved or not. And other challenges like administrative process, and students also challenges at student level, like they feel anxiety and apprehension because they are first time encountered this kind of activities. Expectations, sometimes students are more expected than electives. And teacher supports, attendance and formative assessment, these are the major challenges faced during the elective postings. One more thing is missed here, I would like to bring, like administrative governance. The basically dean is responsible for the design, conduct and implement and evaluation of the electives. And we all know the dean are busy in so many activities, so the dean handed these activity to MEU coordinator, and MEU coordinator usually make two subcommittees, phase 1 subcommittees to manage the block 1, and phase 2 subcommittee to manage the block 2. Phase 1 subcommittees basically coordinate preclinical and paraclinical departments, and phase 2 subcommittees is basically coordinate with the clinical departments. And after this, the departmental heads are responsible for day-to-day effective implementation of the program, elective programs. Thank you. Hopefully my presentation is basically oriented to because we are first time is going to implement electives, and we have most of the departments like big major departments like medicine, surgeries, and major gynaes, and psychiatry also is not a major subject in final examination. So sometimes we are not get a proper representation. Our students are not exposed to psychiatry as in medicine and surgery. So most of students are try to choose electives from those departments. So it is a good opportunity for our psychiatry teachers to represent your departments and attract students to participate in electives from your departments. Thank you.
Thank you, sir. There are a lot of discussions going in the chat box. We'll definitely take it up after one more presentation. Because there are a lot of gray areas and a lot of opportunities also in the electives in psychiatry. We'll discuss it after this session, sir. We'll move ahead from the student's perspective. There's always a dilemma on which book to be chosen, particularly with psychiatry, CBME in the background. And we know that not much of psychiatry books have been concentrating on the CBME curriculum as of now. So to work on this dilemma, we have our young student Pranav from JSS. Over to you, Pranav. You can unmute yourself, Pranav. Yeah, thank you.
Thank you, sir. Okay, good afternoon, everybody. My name is Pranav Kashyap. I like dosas. If you're wondering, yes, that is how I introduce myself. I am a third-year medical student at JSS Medical College in Mysore. So let's dive right into the topic. But right before I go into the core of what I want to talk about, here is one general question that I'd like you to think of. Whenever we go to a restaurant, how long do you usually take to decide what you want to order? A minute, 2 minutes, maybe 3 minutes, at max maybe 5 minutes, right? But there are some of you who probably take 15 minutes, 20 minutes. Maybe you're somebody like me who hasn't decided what you want to order or what you want to eat, and you're already back to your home. So let me connect that with what I want to talk about. You might be somebody who finds choosing a textbook as easy as placing an order at a restaurant, or you might be somebody who finds choosing a textbook as difficult as placing an order at a restaurant. So now this is a problem that I had. Now we all like stories, don't we? So here's a small story for you. The reason why I got into this dilemma right now is that there's a quiz coming up in psychiatry in a month or two, and I'm very interested to take part in it. So of course, I'd need the right amount of material, which is adequate enough for the quiz, because I'd obviously have to prepare. But now psychiatry has only been recently introduced to us as a theoretical subject. We did attend postings last year in the second year, and we've attended, some of us rather, have attended postings this year in third year. But apart from that, we don't really have as much exposure as a final year student to take part in a quiz. So I have a lot of choices. There's information on the internet and there's information from the books. So now let me just list out the options that I had. The first book is, of course, the standard book, which is a short textbook of psychiatry by Dr. Neeraj Ahuja. The second one was Glimpses of Psychiatry for Doctors and Medical Students, which is by Minds United. The third one is Mastering Psychiatry, a core textbook for undergraduates. And finally, students' favorite, Marrow. So I had to obviously choose one of these books from all four of them. And I am somebody who gets very overwhelmed when I'm given too many choices, exactly like a menu card. So, so I obviously had to narrow down my choices to as little as possible so that I wouldn't overwhelm myself. Now, let me talk about the few problems that I had while choosing one book from each. Neeraj Ahuja, while being a great book, it's a standard textbook. The problem I have is that there's no CBME edition available right now. We've had psychiatry classes started already in third year, while it is a final year subject. The problem for a lot of these clinical subjects is that the CVME editions haven't come out yet. So which means the textbooks aren't divided, organized, and categorized according to the competencies. And the classes, of course, are taken for us according to the competencies. So now that's a gray area which we have to adjust with at the moment. The second book, Glimpses, it was a very nice book, I thought, and the way the material is presented is very interesting. Each page is like a story, and reading stories it's nice. And each topic it's given in one page along with a few follow-up questions. A crossword along with it, so it makes it interesting also. But it's again not a pattern that I'm used to. I need to grasp a lot of information and assimilate a lot of information in a very short span of time. So maybe that book is not the right book for me at this point of time. The third book was Mastering Psychiatry. Now, I must say that this book, the pattern of presentation of the content which is there in this, I have not come across it ever before. So the information, instead of being presented in the form of paragraphs, was mostly in the form of tables. And when it comes to tables, the first thing that comes to my mind is data. And psychiatry isn't a subject that I want to read as data. I don't want to remember it as numbers or definitions alone. I like paragraphs. I like mind maps. While I'm not saying I'm not willing to try out something new, maybe again, this isn't a book that is adequate enough or apt enough for me at this point of time. Finally, the last book that I had in my list was Marrow. The great part about this was that there were videos along with it to supplement the content which is there in the notes. And the notes are designed in such a way that there's color coding, there are mind maps, there's ample spacing between all the information that is provided. And there's enough space for you to also go ahead and write your own notes that you want to get from other resources. The problem was that the Marrow as content is very postgraduate exam oriented, and it's extremely useful when it comes to a UG student for our theory exams, because the way our questioning is done is very different from different from the questions that we get for a NEET. So those are the problems I faced. Of course, finally, I did settle with Neeraj Ahuja at this point, because it is a pattern that I'm used to, and I just need a quick source of information that maybe at this point is enough for me for the quiz. And because at the end of the day, the CBME edition is just going to be edits that are going to be made with this book, and not a completely new ball game for us. I feel like it's going to be only an upgrade when the CBME edition for this does come out. With that, I would like to end. I hope I haven't complained too much. I'm not somebody who likes complaining, but here are a few problems that I had, and I hope we can have a discussion about it. Thank you.
Thank you, Pranav. Thank you for letting us know your difficulties and the choices that you had. Probably the CBME is still percolating. We will come up with easier textbooks at an undergraduate level in future. There are a lot of senior people in the forum. They will definitely try to help you out. So the forum is open for discussion. There are a lot of chats in the chat box. You can continue putting your queries in the chat box, or somebody can raise your hand and take turns to ask questions to our speakers. There are a couple of chat box comments. Dr. Ashok sir from St. John says, with respect to STL, teachers can orient students to self-directed learning. They can question the students and model how questions can be posted to our knowledge. A restless inquiring mindset can be the best skill transfer without inadvertently encouraging cynicism. Yes, sir, that's probably a skill and an art that we need to learn as teachers. But I have a question to Dr. Anil. Dr. Anil, if you're here.
Yeah, yes, please.
Yeah, as you rightly said, there is huge resources available.
Yeah.
So is it always, can we specify that these are the things that you need to look at before to the STL and make it more structured, or that again boils down to pedagogy?
Actually, this particular thing I was addressing to, in general, as for doctors, including postgraduates and undergraduates. Yes. But as far as the undergraduates are concerned, as I mentioned, in the end, we are actually providing them the best possible links for them so that they can finish up that particular portion in stipulated time. So that should not be a major issue for them, because we are providing them, it's like a semi SDL kind of thing. Yes. So yeah, that was more of a general kind of issue that I mentioned.
Yes.
Thank you.
Any other queries? Thank you, sir. Any other queries? Yeah, with respect to the electives, I think Dr. Dheerendra Mishra has put on the electives module by NMC for somebody who wants to look at it. And Dr. Ashok sir again has a suggestion that every teacher should encourage their institution to set up a website where elective programs with aims and content and evaluation may be described, and students can definitely look at it and choose from them. He congratulated the Rewa team for getting MU to approve the modules, which is a great idea. Dr. Kishore has more of a pragmatic view. If there is a centralized data, all electives in psychiatry with all details available across the country, there may be more learning. That's a wonderful concept, and probably that's what we are supposed to do. I think IToPs or the IPS itself can take a lead onto that and see if everything can be collated at one place. It becomes a wonderful data. Stress management can also be one of the topics according to Nitisha Verma. But stress management, I think Nitisha is a part of the curriculum itself, and it's also done in the first 2 months in the first year of their postings. So I think the complete module on stress management might be slightly exhausting for the students, but it's a very important topic. It is covered at other places. Research in psychiatry like smartphone addiction, internet addiction, yes, they're all relevant topics. Again, Dr. Ashok has an interesting comment, posting versus course, how much should be the skill component? Again, a difficult question, and we don't know the mindset of the students, because there are specialities and super specialists are also available for the elective postings, I think. So probably students will be more inclined towards other fancier subjects like cardiology, endocrinology, or neurology. So I think we need to come up with something catchy so that students takes up these electives. At Dr. Kishore says at JSS Foundation to adult psychiatry is offered as an elective. And Riaz says that we can upload templates of the teaching learning method, SLOs, SLDs in the UG section. Yes, that's a good suggestion, sir. There are a lot of other things coming up. Anybody else? Anybody else would like to discuss? Sir, Dr. Ashok, sir, if you're in the...
Sorry, there's no option to raise my hand. I'm Anil here. So just two more things I just wanted to add.
Yes, sir.
One is, we in Mahe, we have started a portal by name Medes, wherein we are recording, all topics under medicine for UGs. It includes, all specialties. So it's a small video of 10 to 15 minutes, maybe maximum 20 minutes. So even in psychiatry, we have completed almost 20 recordings now. So, so each individual topic is discussed at the level of UG. That can be one of the sources. Once everything is complete, that will be, made accessible to the medical students of the whole country. So that is again based on the CBME competencies. That will be one source of information. And the second thing, I don't know if it's possible for electives, consultation liaison can also be one of the areas. No, but I think it needs a lot of coordination as well among departments. Maybe that can also be tried, because that's one of the specialties in the Western world, either addiction or geriatric or child or consultation liaison. These are the main specialties. Maybe that can also be an area where UGs can get training at this level. Thank you.
I think as a GHPU, we always have scope for consultation liaison. And I think that's a good opportunity. I think we have one more senior person in the group, Dr. Fayaz Ahmad Sattar, Professor and HOD of Psychiatry at YDE. Sir, if you have any comments, sir.
I should say both good morning and good afternoon to all the speakers and the participants and very eminent educationists from the discipline of psychiatry are there. I just happened to see this morning, I got interested, and particularly I saw Dr. Kiran moderating it. I made it a point that I should do the thing. It's a very good initiative that is going on probably for a long period of time. And the topics so selected are also very good. That is a very important topic of andragogy, that is self-directed learning and pedagogy. The way I look at conceptually and philosophically is that the undergraduates, with whatever degree of motivation they have and the curriculum overload that they have in the CBME or earlier also, the motivation level has been very low. Now, even though CBME has come with all that and so much of importance is given, the students are anyway at the basic level. They are almost like children. And so the knowledge, skill, and application, if you look at it, probably more of pedagogic mode would be required at the CBME level. And for that, a lot of efforts are there, as Anil and Dheerendra Mishra, they have been talking about, particularly availability of videos and other things, resource material, taking it at IPS level and all are very nice. But in a given individual, I personally feel that this dichotomy of pedagogy and andragogy is not really practical. Then when they come to the PG level andragogy, it is all that new words are coming up in the literature, and people are talking of that heterogogic and humanagogic like that. But anyway, the simple thing is that to start with, it is more teacher teaching, and over a period of time, a self-directed learning would come up. Regarding this, the second topic was related to electives. There is a very important point that has to be emphasized probably, is that in the first block, along with the regular routine work of the student, he comes for that, and more it is toward the basic sciences. The second block is very, very important for us if we want to generate more interest and get more students motivated to take up psychiatry. It is that it is a full-time 2 months, that almost 60 days are available to the student. He doesn't attend the routine, he attends the department. I think if the teachers in the departments, psychiatry departments, focus on this full 6 to 8 hours, at least 6 hours, the students are available who take up these electives. As Dr. Kiran has already communicated, it should be very catchy. There are various important topics that are available and which are related to medical humanities, philosophy, psychology, and things like that. There are certain students we should pick up very early, because if take Vaidehi and similar institute, 250 students are available. If we catch those people who are interested right from the beginning and give importance to them, nurture them, and the 60 days when they come probably makes a difference. Anyway, these things can go on, but at the same time, I would like to appreciate everybody in this initiative, and more ideas are coming. I think it is a great initiative. I wish all the best, and any help that can be expected from us, from our institute, and particularly with Dr. Kiran paying so much of attention, I think we are all there for you. Thank you.
Thank you, sir. Thank you for your suggestions and comments, sir. I think we are running out of time. We have made it as a concept that it should be 60 minutes because Sunday is very precious. I think there are a lot of inputs in the chat. This will be recorded and the links will be shared. Dr. Kishore, if you can take over for the final closing remarks.
Thank you so much, Dr. Kiran, and it was wonderful listening to Dr. Anil on a much needed topic of self-directed learning, because the CBME came recently and we are able to see the students now and the self-directed learning which is happening across the institutions. We are not much aware whether the faculty are converting that to a conventional way of teaching. Are they really looking at the objectives of self-directed learning, and how are they involving students in this is still very new to us. And this presentation by Dr. Anil was informative, and the availability of the recording will also help the faculty to look how to use this SDL for enhanced learning of psychiatry. Then Dr. Dheerendra Mishra's presentation on electives has already been discussed in the chat group, is a very new concept in the CBME, and it gives lot of scope for focusing psychiatry teaching learning towards the interest of students, and it gives innumerable opportunities for the department to bring out electives and see how students opt for such electives. And since it is mandatory for the student to pick up, it will also reflect about the departments and how they are conceptualizing these electives. And it can be as simple as what Dr. Dheerendra Mishra has suggested, and it can also be as interesting as perinatal psychiatry. So it is left to the departments to conceptualize and come out with electives, and that will really make the psychiatry teaching learning interesting in the medical colleges and a choice for the students. And the last and the most interesting topic by Pranav Kashyap makes us to think, what are students thinking on, what are their needs, and what is their focus, whether it is quiz, whether it is mastery of psychiatry, whether it is a passage to the post graduation. What is that student looks, and what kind of books is he reading? And as Pranav was saying, we might be thinking about textbooks as uh, conventionally written by authors from various medical institutions, but they might be actually using those run by the coaching institutions like DAMS and Marrow. So we need to build a bridge between their needs and our interest to teaching our interest in teaching psychiatry. So It is going to be a very interesting journey in couple of years as we bridge the need of the society, teachers' inclination, as well as students' interest. And I think the session went really well. Very interesting discussion all through. Thank you, Dr. Kiran, for the opportunity. Over to you.
Yeah. So thank you, Dr. Kishore, for summarizing the session. Thank you all the speakers, Dr. Anil, Dr. Dheerendra, and Dr. Pranav. And thank you for all the participants, for all the senior members for being here. Hopefully, we will encourage screening of these topics in our websites or in the YouTube channels in the near future. Thank you very much. Have a wonderful Sunday.
Thank you all for the opportunity as well as the patient hearing of my session.
Thank you.